This is a bony anatomy review of the elbow and forearm with focus on the distal humerus and the proximal radius and ulna. Looking at the elbow and forearm joints, there are three primary articulations: the humero-ulnar joint, the humero-radial joint, and the radio-ulnar joint. Movements about the elbow and forearm include flexion and extension of the elbow, which occurs at the hinge humero-ulnar joint or elbow joint, and then supination and pronation, which are occurring at the radio-ulnar joint. Beginning with the distal humerus, you'll notice that there are a number of undulations, depressions, and prominences for which we'll name. For orientation purposes, please note that to the left side of your screen currently is medial, and to the right side is lateral, with distal moving towards the bottom and proximal moving towards the top of your screen. Beginning on the most medial and lateral aspect of the distal humerus, you'll notice that there are two large prominences here, which I will outline for you. These are the medial and lateral epicondyles, which are important muscular attachment sites for the common flexor muscles for the wrist and hand and the extensor muscles for the wrist and hand. In between the two lateral, or between the epicondyles, you'll notice that there is a small depression or indentation along the anterior aspect of the distal humerus. If I rotate, you'll see that depression a little bit better. This is the coronoid fossa. The coronoid fossa is important because it is what receives the coronoid process of the ulna, seen here. Inferior to the coronoid fossa, you'll notice that there is a white articular surface to the distal humerus, which articulates with the ulna and the radius. The medial most aspect of this articular surface is known as the trochlea. The lateral portion of this surface is known as the capitulum. The capitulum articulates with the head of the radius, and the trochlea articulates with the ulna. Just lateral to the coronoid fossa, you'll notice that there is another small, if I rotate up here, another small indentation within the distal humerus, seen here. Again, that's lateral to the coronoid fossa. This would be the radial fossa, which is going to receive the head of the radius during terminal elbow flexion. And then lastly, if we flip over to the posterior aspect of the elbow, and remove the ulna, you'll notice that there is a very large depression or indentation within the distal humerus, seen here, where the arrow is pointing. This is known as the olecranon fossa. The olecranon fossa is going to receive the olecranon process of the ulna. If we remove the humerus and leave just the ulna and the radius, seen here, first focusing on the proximal ulna. Again, the very large proximal end of the ulna. This is the olecranon process, which sits within the olecranon fossa of the humerus. And then anteriorly on the ulna, we have the large beak prominence, which is the coronoid process. The coronoid process sits in the coronoid fossa of the humerus. This is what gives us our humero-ulnar joint, which is the primary elbow hinge joint. If we look at the ulna and the radius from an anterior view, as seen here, you'll notice the articulation between the proximal ulna and the proximal radius. If I draw the line right there, the radial ulnar joint. This is, again, where we are getting the movements of supination and pronation from. And if we remove the radius, you'll notice the slight indentation here. I'll draw it, and then we'll move the model around a little bit so you can see that better. That small indentation is the radial notch, where the radial head sits and articulates with the proximal ulna. If we bring the radius back in, there are a couple of bony landmarks to take note of on the proximal radius. The first of which is the proximal end of the radius, the radial head, which again articulates with the capitulum of the humerus and medially articulates with the ulna at the radial notch. Inferior or distal to the radial head, at the narrowing of the radius, this would be the radial neck. And then further distal from that, you'll notice that there is a outcropping of the bone. If I outline it here, that outcropping on the bone, which can be visualized a little bit better here from a slight oblique medial anterior view, this is the radial tuberosity, which would be the attachment site for the biceps brachii. Lastly, to take note of, which we'll look at in more detail in the soft tissue review, is what's known as the cubital fossa, roughly outlined here in red. The cubital fossa contains some important structures, including the brachial artery, the median nerve, and the biceps brachii tendon. So often if we have swelling within the cubital fossa from trauma to the elbow, it'll result in compression of the median nerve, which will then cause radicular symptoms down into the hand and fingers, similar to that of carpal tunnel syndrome.